Hi, I'm Travis. I'm going to be your nurse today.
Hi.
Can I have your name and date of birth, please?
Yes, it's Nikki Reed, March 8th, 1995.
Perfect. And do you know where you are?
Yes, I'm in the room.
Do you know why you're here?
Yes, for a general assessment.
Perfect. Are you okay with me going over a physical assessment with you from head to toe, just making sure that everything's okay?
Yes.
Okay. At this point, I've established that the patient is alert and oriented ×4. I've made sure that the curtain would be drawn or the door is shut. I have all of my equipment sterilized and ready for the evaluation and assessment process. I'm now going to generally survey the patient just from a visual standpoint and see that her skin is intact and has good color. There's no sign of deformity or trauma. She knows where she is, why she's here. Her speech pattern is within normal range. And I will move forward now and inspect the head. I see no sign of lesions or swelling, any discoloration. I would now, if there were lesions, I would don gloves, but there are none. Do you mind if I check your scalp and palpate you for any kind of pain? Do you have any pain? On a scale of 0 to 10, 0 being no pain, 10 being the worst pain of your life, what's your pain level at?
0.
Perfect. And again, do you mind if I palpate your head to make sure everything's okay?
No.
Perfect. Her scalp looks to be free of any lesions or masses and swelling. I'm now going to move forward and assess her eyes. I'm going to ask you a few questions, okay? So hold still and just look straight ahead. Perfect. I want you to follow my pen, okay? Don't move your head, just with your eyes. Perfect. The 6 cardinal fields of gaze and her pupils are equal, round, reactive to light, and accommodate. And again, her 6 cardinal fields of gaze are intact as well. So cranial nerve 7 is working properly. I'm now going to assess her face. I don't see any discoloration, any signs of swelling, no drainage of any kind from the eyes, nose, or mouth, or ears at this point. Do you have any pain anywhere on your face or your ears? Okay. Do you mind if I palpate your ears and your facial bones? Thank you. Let me know if you feel any pain. Is there any pain?
No.
Perfect. Now I'm going to assess your, I meant to check your TMJ, so tell me, tell me if you feel pain when you do this. Open your mouth, close it. Any pain?
No.
Perfect. I didn't feel any kind of crepitus or any crackling. Go ahead and tilt your head back. I can just assess from this point. You can scoot down a little bit if it's more comfortable. Just tilt your head back for me. Perfect. I can tell that the trachea is midline, and I don't see any signs of swelling or any discoloration. Since she's in this position, I'm also going to check her nares, which are pink and free of any kind of drainage or bleeding. I'm going to now check for patency of her nose. So do me a favor and close one nostril and inhale and blow out. Same one with the other one. Any trouble with either side, breathing, any pain?
No.
So patency is normal bilaterally. I'm now going to check. I can see that her lips are dry. There's not abnormally dry, but dry. No cracking, no bleeding. Do you mind opening your mouth for me? Her teeth, buccal mucosa, her gums. Stick your tongue out and say ah. Uvula retracted. Normally, tongue looks to be pink and healthy. And the hard and soft palate all have good color and no signs of deformity. Stepped on a line here. If you can sit up a little bit for me. Tilt your head back, down, to the right, to the left. Perfect. Patient has full range of motion. Again, no signs of swelling or edema anywhere in her head. Her eyes, have good color, no redness, no drainage of any kind. Can you pull down your eyelid for me? Pull it down more. Perfect. Her conjunctiva are pink and both sides. Perfect. You can lay back and just relax. So I'm now going to check your, let's see, I checked your mouth and she was able to stick out her tongue. Can you stick out your tongue again? Move it side to side for me. So cranial nerves 9, 10, 12, and 7 are all intact from my assessment so far. I'm now going to move forward with her, I didn't ask you to, can you smile, frown, and puff your cheeks out? Perfect. Now I know that cranial nerves are all intact. I'm going to move forward down to her arms now, starting with her upper extremities. I noticed that her muscle bulk looks symmetrical and even on both sides. Do you mind if I palpate let me know if you feel any pain?
No pain.
No pain? Radial pulses are +2 bilaterally. I actually forgot to check. Her carotid pulses are also +2 bilaterally. There was no abnormal muscle bulk in her upper extremities. I'm going to go ahead and have you push up. There you go. Now lift your arms up, push down. Perfect. Roll your hands like this, other way. Can you raise your arms up, down? Perfect. She has full range of motion in her upper extremities. I didn't feel any signs of crepitus, no signs of redness or edema. Her cap refill is less than 3 seconds bilaterally on both sides. Everything, no signs of discoloration. There was no pain associated with your arms. Perfect. I'm now going to have you sit up for me if you can. I'm going to now assess her anterior and posterior thorax. Do you have any pain when you breathe? Any kind of tightness? Nothing? Okay. Do you have any history of asthma or any kind of respiratory distress?
No.
Perfect. Okay. First, I'm going to palpate her anterior thorax in 8 locations. Let me know if you feel any pain, okay? Any pain there?
No.
Since she's sitting up, I'm going to do her posterior as well. Let me know if you feel any pain. Any pain?
No.
Ticklish?
Yes.
Good. Okay. Now if you just kind of scoot back and you can kind of relax in there. I'm now going to auscultate for her anterior thorax in 8 locations with the diaphragm. And just breathe normally, okay? I didn't hear any wheezes or any adventitious breath sounds. Is there any pain associated when I did that?
Mm-mm.
Perfect. I'm gonna have you sit up for me again. See, this is where they want to be able to see.
Turn around.
Yeah, never mind. Perfect. Again, I did palpate the 8 regions. I should have moved the camera before I did that. Okay, again, just breathe normally for me, okay? No adventitious breath sounds to note. While she's sitting up, I noticed that she has a 1-to-2 ratio. No signs of barrel chest. I didn't hear any adventitious breath sounds again of any kind. Respiration rate was normal. Okay, I'm going to have you go ahead and get back up. Thank you. Now I'm going to move forward with the cardiac assessment. I'm going to palpate again in the 5 regions, the aortic. Let me know if you feel any pain, okay? The pulmonic, herbs, tricuspid, and the mitral. Is there any pain? Okay, I don't see any signs of lifts, heaves, or visually I can't see the PMI, and there was no pain upon palpitation of all 5 areas. I'm now going to auscultate. Just breathe normally, okay? Excuse my hands. Okay, I'm going to go hold this one for a minute, okay?
Okay.
It's really 10 seconds. So that would normally be a minute for auscultating the apical pulse. It was normal, 66 beats per minute. S1 and S2 sounds were all normal. I heard, forgot to go back. I'm going to go back one more time with the bell of the stethoscope. Okay. Sorry about that. Same sequence though, just backwards, okay. then you go backwards with the bell of the stethoscope. Mitral valve, tricuspid, Erb's point, pulmonic and aortic valve. No, I didn't hear any murmurs. Again, S1 and S2 were noted. Apical pulse was normal. I'm now going to move forward and have you kind of lay flat. I'm going to assess your abdomen really quick.
Okay.
Just going to flatten your shirt out. Is that okay? Are you comfortable?
Mm-hmm.
You're warm enough and everything?
Yeah.
Not causing any pain? Perfect. I'm going to first begin by palpating the 4 quadrants, starting with the right lower. I'm just going to lightly palpate, okay, and let me know if you feel any kind of pain. I'm feeling for any kind of masses or tenderness. Let me know if you feel anything. Is there any pain when I do this? Okay, there was no pain upon palpation. Prior to that, I forgot to note visual inspection. Contour is normal. Umbilicus is centered on the midline. Everything appears, there's no signs of bruising or redness or any kind of edema. No distended abdomen of any kind, no pain upon palpitation. I'm now going to also take your same 4 quadrants, okay? And listen for irregular bowel sounds. No pain when I did that. Perfect. I heard no signs of hypo or hyperactive bowel. There was no pain. Again, everything looks good on the abdomen. Now going to move forward with the lower extremity portion of the assessment. You can sit back up if you'd like. If there were a gown, I'd make sure she was covered, and always keeping everything covered unless I was inspecting it. Assessing it. Just visually looking over her legs, skin color is really good. Muscle bulk appears symmetrical and even and normal on both sides. I don't see any signs of masses, redness, or edema. Can you bend your legs up? And then kick them out. Push against my heels. My hands. Pull rather, so you're pulling, push, perfect. +5 strength on both sides. I forgot to note that she had, forgot to do her upper extremity strength. So stick your arms out for me. Push up against my hands. Down. Perfect. Pull your wrists up. Push them down. Perfect. Go and grip my fingers with both. Perfect. Hold your thumbs out like that. No signs of clubbing. Forgot to do that also. And that her strength is +5 bilaterally on both sides on the upper and lower extremities. She has socks on, but I would check both sides, of course, for cap refill, which is less than 3 seconds on both sides. +5 strength, skin looks intact and normal, muscle bulk looks good. She has full, can you move your legs up? Just lift them up and kick them out a little bit. You roll them around. Any pain? I don't hear any crackling, anything at all. Full range of motion, strength's good. I'm going to palpate early. Do you mind if I palpate your legs? Make sure that there's no sign. Let me know if you feel any kind of pain, okay? Making sure to note the bony protuberances. Again, I'm not seeing any discoloration. Skin and nails look good. I also didn't note that. I forgot that too. Any pain? Any pain at all? Perfect. So pain was 0, strength was +5 on all extremities, good range of motion on both, good cap refill. I'm going to check the pulses. Oops, sorry. Oh. That's good. I'm checking the dorsalis pedis and the tibialis anterior pulses, which are both +2. I'm going to have you roll onto your right side for me. Just making sure to check the posterior. I'm going to palpate the back of your legs. Is that okay? No discoloration. Muscle bulk looks good on both sides. Skin is dry and intact. No signs of lesions, no sign of pain. Okay, you can lay back up and sit up for me. Lean forward for me, actually. Actually, can you turn around? Sorry. The patient's being very compliant. I'm going to lightly tap on your lower back, okay? Let me know if you feel any pain. Any pain? CVA, no pain. CVA is good. And after this, I'll make sure the patient can lay back down and get comfortable. Do you have any questions about anything that I did?
No.
Perfect. Did I cause any pain?
No.
Perfect. Patient, everything was within normal range.